Kia ora koutou. Welcome to our second live streaming session. So this session is focused on questions from Farno, but everybody's welcome. As you may be aware, we got the go-ahead last week and we announced that the prototype, the new transform system, will go live in Mid-Central on the 1st of October. So here's a chance for you to ask all of the questions that you want to ask about what does it mean for you and your whānau. I might not be able to answer all of your questions now, but if I don't, I will make sure that we get the information out to you on the website as soon as possible afterwards. Also, just want to remind people that we've got things out for virtual testing at the moment, and if you're interested in being involved in virtual testing, especially around the funding allocation, which I know lots of people are, or around how the system will work for people who have complex or high needs, please contact us at stfeedback@moh.govt.nz. Now, if you want to ask questions tonight, you'll be able to send an email to us at stfeedback@moh.govt.nz. So I'm going to start now. The first question's coming from Selwyn, and it was sent in early, so not coming through on the live streaming. Will there be a space for young people with autism or on the spectrum who are not under Mid-Central DHB to apply to be in the new system? So under the transform system, what the scope of who's in for this is anybody who is eligible for disability support services funding funded by the Ministry of Health. So that means that means everybody who is currently receiving support, but also there might be other people who are eligible but aren't currently receiving support, and that includes people with autism. There is also one of the things that came up in the co-design process was that for some people, particularly young children, where it may not be the right time to get a diagnosis, and that has meant that they haven't been able to get access to support. So we're doing some policy work on that issue, and we are going to be going to Cabinet to look at whether we can extend eligibility for children who before they get a diagnosis, so that they can get support from things like child development services and behaviour support services. So we'll be able to tell you more about that later in the year. Also got a question that came up last night and didn't have a chance to answer it last night, which was from Nikki. She's concerned that the new system will not have the dollars in it for her son to be safe without her having to give up work. He can't be alone and they provide huge natural support. He's currently at school but not far away from leaving. One of the things that we really want to make work in the system is to actually look at the overall whānau and to look at in terms of investing in disabled people and families. And one of the things that we want to do is to support family members to still be able to continue to work. So at the point that people transition to different life stages, often their support needs do change, and that is, we will be encouraging people to talk about what are they wanting to do with their lives, and then to look at the funding that is needed to support them to do what they want to do. So yes, there is always going to be a lot of demands on the system, and we need to ensure that the funding is allocated in a way that is equitable for everybody within the pool we've got, but also to make sure that it's disabled people and families who have the say about how they use that funding. I've also got a prepared question that came in early today from Selwyn asking, does the new system include housing modifications? And yes, housing modifications are within the scope of the Transformed Disability Support System. We're still working through whether there will be any changes to how we do that, and we'll be coming back with more detail about that over the next couple of months. I've got another question that came in earlier. If some people will be supported under residential providers, will there be additional funding? Currently, people in residential care have minimal funds after their costs are paid to their provider. So for those of you who've read the Cabinet paper, there is some additional funding in scope that will go on direct support. From memory, I think it's around $6 million, and I just haven't got the number in front of me. And that will be looking at particularly what we can do to put in place to support people to stay in the community, to be able to do the things that they want to do. But also this particular issue around the funding that people have available if they're getting the residential care subsidy is one of the policy issues that has been raised. So we're doing some further work on that one as well, but unfortunately I don't have an answer for you on that right now. Also a question that Stephanie has sent through earlier about how will families in Farno be kept informed about the new system and all of the changes between now and the 1st of October. Well, this is the start of a lot of communication that we want to do with disabled people, with whānau, with providers, with the workforce across Mid-Central. So we are planning to have information available in a range of ways that works for people. So we'd be really interested to know whether this kind of format of having the opportunity to ask questions and have them answered works for you. We'll also be organising face-to-face forums, not just in Palmerston North, but in some of the other places across Mid-Central region. So for example, having things in Levin or Otaki or Fielding or Dannevirke. So having some face-to-face forums. I'll continue to do my monthly updates. We will also be sending out letters to people, and we really welcome any other feedback around how you would like to get information about what's going to be placed on the 1st of October, what you need to know going into that, and to have a chance to be able to meet other people who are working through what it will mean for them as well. Just got a question from John. Will my disability funding be reduced to pay for this new system? No. All in terms of the transform system, more funding has gone in for direct support, and there has been additional funding put in from the government overall of 23.84 million that will be used for additional direct funding to support people, also for the costs of some of the new roles in the system, for example, connectors, some of the one-off costs, so the costs of the system transformation team, evaluation and monitoring, and also to continue the demonstration in Waikato and the Enabling Good Lives approach in Christchurch. I've also had a question that's come in earlier from Martin saying, do my son and I have to use a connector? And the answer to that is no. Everyone will have access to a connector and be able to choose a connector if they want to work with a connector, but you don't have to have one. There will be ways that you can engage with the system either by talking to somebody on the phone, emailing us, or being able to come and talk to somebody face to face, but you don't have to work with a connector if you don't want to. However, if you choose not to work with a connector, we will still need to gather some information from you to be able to work through the process of understanding what you want to do, what support you need, and to make a decision about funding, and then how you want to have your funding managed and to make that happen for you. I've also had a question about from Sophia that was sent in earlier about, I don't understand why you need to have two teams. Won't that be confusing for people? Now, we've had a lot of feedback from the sector about the need to keep the connector role, which is an ally who walks alongside disabled people and families, separate from the people who make funding decisions. And so that's why in the prototype we're trying two teams. But there will really be one front-facing part of the organisation that for disabled people and families, and that'll either be through connectors or through disability information specialists who people talk to on the phone, see face-to-face, or in response to emails. And both teams will work to support disabled people and whānau. So it should all be seamless. That's what we're aiming to do. And as we work through that, we will be looking for feedback from disabled people and families about how that's working. Just had a question from Angela. The new model, even though it's great to have more choice, appears to put more organising and admin requirements onto whānau. What happens when they can no longer do this? In the transform system, there will be options about how to manage things. So disabled people and families can choose about what they want to do and what they want to organise and to what extent they want to be involved. So for example, I think when people think about administration, they're often thinking about do I have to employ support workers? Will I have to manage the money? What we're going to have is a range of options within the system for disabled people and families. So you can choose to have the support funding in a bank account and to manage it all yourself, including employing people. But you could also go to somebody that you know or within the community like an accountant and get them to do that for you. Or there will be host provider options available, or you'll be able to go to a provider for them to do that for you. You may or may not want to actually negotiate directly with the provider. We'll also have options where you say, look, actually, we want to work with this provider, but we want you to do all of the paperwork and organising behind the scenes. So in the system, you don't need to manage all of the administration yourself. There will be options about how to do that. One of the other things in the new system where we're trying to take away some of that administration for disabled people and families is around the access to other government support and trying to make it seamless so that for things where you need to go to another government agency for one-off type transactions, so for example, benefit paperwork or organising a disability allowance, in the new system you'll be able to work with a connector to actually fill out those forms, and then they will arrange for those to be processed in the background. So we're also hoping that that will take away some of the administration and form filling for disabled people and families in particular. I've got a question from Rose around, will families be recognised as paid carers? So within the transformed system, there will still be some policy settings or rules around what you can and can't do with the support, with the funding that's available, and we want to minimise those. But any decisions that are made about who can or can't can't provide care will be moved over into the transform system, and then we'll make it, we will put that into the guidance and guidelines about how that works. So there is, that is something that whatever the decisions are made about things like the role that families play in care will be added into the options, but also what you need to do in terms of the who you can use in terms of family carers. I've also had, Rose, how can family whānau get connected to the core group face-to-face? So my understanding is that the family whānau core group is meeting in Palmerston North monthly. I don't have that information available on me here, but what we will do is make that information available on the website to people so that they can get in touch. We also, I met with some of the members of the family core group last week, and one of the things we also talked about is actually me coming and being at some meetings in some of the other centres. So not just having meetings in Palmerston North, but over the next few months actually having some core group meetings with people from the core group, but also with me there for some of the time so that people can ask questions. So we will also make that information available on the website. Also, if you do want to find out more about getting connected to that whānau core group, you can contact us at stfeedback@moh.govt.nz and we will get somebody to contact you. I've had a question from Brent. Who will decide how much money is allocated per child, and will all that money be available for that child, or will some be kept with either ministry? So at the moment we have developed some proposals around how the funding allocation processes will work, and those are out for testing at the moment. So if you're interested in providing feedback, if you contact us at stfeedback@moh.govt.nz, we can add you to the virtual testing group for that. Or if you don't want to use the Loomio decision-making tool, we can also email the information to you. But going back to Brent's specific question, who will decide how much money is allocated per child? That the decisions will be made by the funding coordinator within the system enabling team. But there will also be processes for if people aren't happy with the decision, for those decisions to be reviewed, including having an independent panel that includes disabled people and whānau on it. You've also asked, will all that money be available for that child, or will some be kept with either ministry? In terms of the funding that will be available, we are looking at, I think the question you're asking is, will it all be in a personal budget or not? And I think some of the things we're working through is that for some things, there are more benefits from keeping the money together for buying in bulk, for example. So equipment, we might get greater benefits from purchasing lots at once rather than what someone could with their individual purchasing power. And so in that case, we might decide that actually it's better to centrally purchase things. Also, where we think there is a potential that that people will not continue to get that service or support if we don't continue to purchase it centrally. So for example, we get a lot of feedback at the moment about challenges finding providers who with the right workforce to provide support for people with challenging behaviours. So that might be an area where we continue to purchase centrally to ensure that there continues to be support available for all disabled people who need it. We've got a question from James. How will disabled people be involved in decision making in the new system? So within the new system, there will be a governance group that is a subset of the regional leadership group that includes disabled people, whānau, and provider reps on it, and mana whenua. And that governance group will make decisions on things like the priorities for funding, capability funding, the priorities for that. So there will be decision making made by the governance group that includes disabled people in it. There is also disabled people involved at each level of decision making over the system transformation program. So we've got a governance group that includes 2 disabled people and a family member from the National Enabling Good Lives Leadership Group, and officials from government agencies, Ministry of Health, Education, Social Development, ACC and Oranga Tamariki, and they make the decisions about what recommendations go to ministers. We also, I've talked about the regional leadership group, and we are looking at how we can get disabled people and families involved in all parts of decision making in the new system. I've got a question about how do we access the Loomio tool. If you send an email to us at stfeedback@moh.govt.nz, we will add you and you'll get sent an invitation to a specific virtual testing group. So for example, at the moment we have got testing groups on the funding allocation, tools and processes, and we've also got one on how will the new system work for high and complex. And so you can say which group you're interested in, and we will send you an invitation to join that conversation virtual conversation using the Loomio tool. But if that doesn't work for you, we can also send documents out to you by email.